Now the pharmacodynamics of benzodiazepine. The pharmacodynamics is the part of pharmacology that deals with the how the drug works in the body. That means the mechanism of action of the drug is the topic of pharmacodynamics. So, a mechanism of action, if we want to discuss the matter of mechanism of action, first of all is the receptor. So, benzodiazepine binds with the GABAa receptor. GABAa receptor is the macromolecule complex. Here, 5 subunits of macromolecule unite to form a ion channel, that is the chloride channel. Here is the benzodiazepine receptor, that means the GABAa receptor. It has the 2 alpha subunits, 2 beta subunits and 1 gamma subunits. These 5 subunits of macromolecules form a complex through which there is a channel of transport of chloride ion from outside to inside. And this receptor has some different binding sites of different molecules. Here we see that the area of between the alpha and gamma, area between the alpha and beta, and here is the beta and gamma. If we see the receptor very closely, here is the receptor, and we can see that this is the gamma and this is the alpha. In between the gamma and alpha, the benzodiazepine binds, and this is the beta and this is the alpha. In between the alpha beta, there are 2 sides between alpha and beta. Here the GABA, the original neurotransmitter, inhibitory neurotransmitter that binds in between the alpha and beta subunits, and the benzodiazepine binds with in between the gamma and alpha subunit. Benzodiazepine binds here, and some non-benzodiazepine, that is known sometimes called the new benzodiazepine or Z compounds, they also bind here in this in between the alpha and gamma subunit. And another drug, that is the benzodiazepine antagonist, that is the flumazenil, it also binds here to inhibit the binding of benzodiazepine. Here is the benzodiazepine binding sites. Here is the GABA binding site. There is another drug binds in this receptor, that is the barbiturate. Barbiturate binds here. We will talk it later. So one interesting thing in about the benzodiazepine receptor or the pharmacology of benzodiazepine, that the original neurotransmitter, that GABA binds in a site that is different from the drug binding site. So you have learned the autonomic pharmacology or other drugs where there is the site of acetylcholine binding or adrenaline binding, and the drug also bind in this site. So the drug that binds here and causes the activation of this receptor is the agonist, and that binds here and causes the inhibition of the receptor, that is called the antagonist. In the neurotransmitter or the physiological ligand binding site, in the other cases the drug binds, that means pharmacological ligand bind in the physiological ligand binding site. But for the benzodiazepine bind in the different site than the pharmacological physiological ligand binding site. Here the physiological GABA receptor binds, and here the pharmacological benzodiazepine binds. This receptor and this pharmacology is unique in connection to other receptors. That means the agonist, physiological agonist and pharmacological agonist has the different binding sites. And another thing, that the antagonist of benzodiazepine, the flumazenil, you have to memorize this flumazenil, that is the that binds in here. But the chloride channel, after binding the benzodiazepine in this site, the effect is not the opening of the chloride channel. The benzodiazepine binds here to facilitate the binding of the GABA. That means the action will be exerted by the GABA, and benzodiazepine invites the GABA to bind this site as a result of the opening of the chloride channel. So, benzodiazepine directly cannot open this chloride channel. I think it is clear. In this connection, there is a question: how does the benzodiazepine and how does the barbiturate? That means previously I have said that in this alpha subunit there is another receptor, another drug binding site. Here the barbiturate binds. The binding of barbiturate also allow the opening of the chloride channel. These are the inhibitory action to this receptor. So there is a question how the barbiturate works on chloride channel and how the benzodiazepine works on chloride channel. There is first thing, they have the different binding sites in this receptor. Benzodiazepine binds in between the alpha and GABA subunit, but the barbiturate binds in the alpha subunit. And after binding the benzodiazepine in the receptor site, it allows the GABA to attach here so that the chloride channel will open. Binding the benzodiazepine cannot directly open this chloride channel, but barbiturate has limited capacity in high dose to directly open this chloride channel, and barbiturate has another receptor sites where barbiturate can bind to modulate the function of the cell. So this is the difference between the barbiturate and benzodiazepine. Our topic is the benzodiazepine, and benzodiazepine, after binding the benzodiazepine on this site, it allows the receptor to open more frequently. That means here is a opening here. That means if we draw this action, it will open this. This is the opening of ion channel. There is another opening of ion channel. There is another opening of the. Here we can see it is occurring on 2-3 times. But in the barbiturate, it opens it in single time. That means in benzodiazepine has the ability to open the chloride channel more frequently, and in the barbiturate it has the less frequently. It has opened a single time, and it has opened it multiple times. That means the binding the benzodiazepine to this receptor opens the chloride channel more frequently. So benzodiazepine opens. Benzodiazepine has an action that causes the opening, that causes the increase the frequency of chloride channel opening. But in case of barbiturate, it causes the duration of action. Here, the duration of action is more in case of barbiturate. So, the difference between the benzodiazepine and barbiturate on the receptor is the frequency and duration. And the benzodiazepine antagonist is the flumazenil, and there is another antagonist that causes the closure of this chloride channel directly. That is the you can see that is the picrotoxin. This is the drug that directly antagonizes the chloride channel. So the barbiturate receptor, the GABA receptor has some agonist. This agonist is different from the other agonist, and it has some antagonist. These antagonists also differ. Two types of antagonist. One is benzodiazepine receptor antagonist, another is chloride channel antagonist. So these are the receptor pharmacology of the benzodiazepine. Now we will see what are the action of benzodiazepine over the different parts of the body, different systems of the body. Thank you all.